Hello again, and welcome back to another edition of Mayo Men's Health Moment. Thanks to all of you who watched my previous videos. This will be an update on the penile implant pump. So some of these slides will be a review from my previous talk on how to use the penile implant pump, but it's worth reviewing some of the key points. Remember that after the procedure, typically the scrotum is the most sore part of the body where the pump is. We try to prevent this pain by using long-acting pain medication, etc. However, it still ends up being pretty sore. To help with this, you can wear 2 pairs of underwear, or you can use Body Glide. This is the same stuff that marathon runners use to help prevent chafing in races. In the first couple of weeks, most surgeons will say not to manipulate the pump, but you can try to feel where the landmarks are, and so this is best done in a warm bath or a shower, where you can start to feel the edges and the characteristics of the pump that you'll soon be using. Some surgeons will say to pull down on the pump immediately post-procedurally. This is particularly true in men who get their implant with an infrapubic approach. I use a peniscrotal surgical technique. So if you get the surgery with me, you do not need to touch the pump other than trying to feel where the landmarks are. Do not pull on it, etc. We'll teach you how to use it, etc. at the 3-week mark. It is important to inflate the device maximally for an hour a day for the first year after surgery once you get the green light to use it. There are some studies which are highlighted here in the box, which basically say that men who inflate the device daily end up with longer penises when you do good measurements, and they end up with higher satisfaction. I think what probably is going on here is that after you get the implant in, the body tries to put what's called a surgical capsule around the device, and so that can shrink the size of the implant even if it's sized properly. By inflating it daily, you manipulate that capsule so that you optimize the penile size. So at the end of the day, do you actually increase the size of the penis with this penile implant surgery? Probably not. You probably maintain what it should have been prior to surgery. So in the last video, you can see these are the kind of newest pumps on the market, which a lot of surgeons are using. On your left is the Coloplast touch pump, and on the right is the AMS pump. These are both reliable pumps, but I've actually switched to this pump, which is the old Coloplast Genesis pump. As you can see from the picture, it's actually a little bit smaller in profile. Feedback from my patients and my nurses who teach the men how to use these devices is that it's much easier to learn, and it's actually easier to deliver fluid in the device to inflate it. So far, there's no reports in the literature about sticky pump syndrome, which happens with both of the other pumps from the last slide. And so it's really reliable, and that's why I really like it. A lot of high-volume implanters who do more than 50 to 100 a year actually have switched to using this pump because of its reliability, its ease of use, and its smaller profile. One caveat is that it does require 2 hands to deflate the device as seen in the picture. The other pumps are so-called one-touch release, which isn't entirely accurate because you do have to squeeze some of the fluid out of the penis when you deflate it, but this one you definitely have to have 2 hands to deflate it properly. You can see the characteristics of this pump, hopefully, on this video. So what I like about this pump is its smaller profile, so much smaller bulb. And then the release valve is very easy to distinguish depending on what side you're on. So when you go to grab this, you'll know for sure that you're hitting the release bars, whereas if you grab it like this, that isn't going to do anything. So the previous pump models, the 2 sides were very similar, at least the old Coloplast pump was, so it was sometimes hard to tell which side was which. The other thing I like about this pump is it's much easier to inflate and deflate, doesn't require as much force, and there's really no history of any mechanical problems with this one. To review inflation technique, I advocate the one-handed pump technique. So you basically pretend like you're thumb wrestling. You lock in the pump here and then drive the fluid like so. That uses this part of the thumb muscle, which is a very strong part of the hand. Other practitioners will have you use the thumb over thumb technique, where you actually put your first thumb on and then your second thumb on and then drive the fluid in like this, which really can get a lot of fluid in there very efficiently. So in summary of some of the other penile implant pump tips and tricks from my other video, again, worth going over. It's normal to be sore. At 1 month, half the men are using the device for sex. At 2 months, the other half are. Some quote 3 weeks and 6 weeks for those statistics. Remember that it takes a little patience and getting used to learn how to work these things properly. The pump will soften up with time, like a baseball glove. In order to determine get the most force out of a pump, you want to use the thumb wrestling grip or the thumb over thumb technique, as I demonstrated. Remember that after you squeeze the pump, you need to let it refill, otherwise it's not going to fill efficiently. Toward the end of filling, it's always going to be more difficult to inflate the device to 100%. Most men will use the device at 70% inflation, but if you want to get it to 100%, it's going to take more and more force to get it there, just like if you're inflating a bike tire. It's normal for any pump to squeak slightly, and that's okay. Sometimes men will have their partners help inflate the device. That's totally normal. And then with the former two pumps, you can get the sticky pump syndrome, which sometimes requires surgical revision. That's why I've essentially switched to the older Coloplast pump, because in my hands, it's never required surgical revision, nor is there case reports of that in the literature. And then finally, if you do have a new chatter or Rice Krispies sound when you inflate the device, that typically means there's a fluid leak, and that's going to require revision surgery. I hope you found this video from the Mayo Men's Health Moment on Penile Implant Pump useful and informative. As always, if you have questions, you can email us at the email link below, or give us a phone call if you want to schedule an appointment. Till next time, Toby Kohler signing off.